Welcome to Roadmap to Residency Evidence-Based Applications. So in this video, we will be discussing about renal and urinary tract pathology. I tell you before that the different topics that we are going to touch in this video are very in detail discussed in the renal pathology modules. You can go and check those. So this will be only a slight revision for you all. So, which of the following pathological changes is most characteristic of nephrolithiasis in this patient? A 35-year-old man presents to the emergency department with severe left flank pain and hematuria. He describes the pain as sharp and colicky, radiating to the groin. Physical examination reveals tenderness in the left costovertebral angle. Lab investigations show macroscopic hematuria. Imaging studies demonstrate a 4 mm radio-opaque calculus in the left renal pelvis. Biopsy of the renal pelvis is performed, and histopathological examination reveals deposits of calcium oxalate crystals surrounded by inflammatory cells. Which of the following pathological changes is most characteristic of nephrolithiasis in this patient? Fibrosis scarring and tubular atrophy, glomerular basement membrane thickening and immune complex deposition, tubular dilatation and cyst formation, calcium oxalate crystal deposition and inflammatory cell infiltration, tubulointerstitial fibrosis and mononuclear cell infiltrate. So the correct answer is calcium oxalate crystal deposition and inflammatory cell infiltration. Nephrolithiasis, or kidney stones, is characterized by the formation of calculi within the urinary tract. The most common type of kidney stone is a calcium oxalate stone, which forms as a result of hypercalciuria and or hyperoxaluria. Histopathological examination of renal tissue in patients with nephrolithiasis may reveal deposits of calcium oxalate crystals within the renal tubules and interstitium. Now, these crystals can cause mechanical obstruction, leading to acute renal colic and hematuria. In addition to crystal deposition, inflammatory cell infiltration, primarily neutrophils, may be seen in response to tissue injury caused by presence of calculi. Let's go towards the other question. So which of the following pathological feature is most characteristic of renal cell carcinoma in this patient? 60-year-old man presents to his urologist with complaints of left sided flank pain and gross hematuria. He reports unintentional weight loss over the past few months. Physical examination reveals the palpable mass in the left flank region. Imaging studies show a large enhancing mass arising from the upper pole of the left kidney. A radical nephrectomy is performed, and histopathological examination of the resected specimen reveals nests of polygonal cells with clear cytoplasm and prominent vasculature. Which of the following pathological features is most characteristic of renal cell carcinoma in this patient? Papillary architecture and psammoma bodies, neuroendocrine differentiation and chromogranin 8 positivity, squamous differentiation and keratin polyp formation, clear cytoplasm and prominent vascular network, spindle cell morphology, and desmoplastic stroma. The correct answer is clear cytoplasm and prominent vascular network. Renal cell carcinoma is the most common type of kidney cancer, accounting for approximately 90% of all renal cancer. The most common histological subtype is clear cell carcinoma, which is characterized by nest or cords of polygonal cells with clear cytoplasm and prominent vascular network. Clear cell renal cell carcinoma often arises from the proximal tubular epithelium of the kidney. These lines are very, very important. The clear cytoplasm is due to the accumulation of glycogen and lipids within the tumor cell. Additionally, the prominent vascular network, often referred to as a chicken wire or lace-like vasculature, is the characteristic feature of clear cell renal cell carcinoma. So, a 70-year-old woman with a history of hypertension and diabetes mellitus presents to the nephrology clinic with complaints of generalized weakness, decreased urine output, and peripheral edema over the past few weeks. Lab investigation revealed elevated serum creatinine and blood urea nitrogen levels. Urine analysis shows proteinuria, hematuria, and granular cast. Renal ultrasound demonstrates bilateral small echogenic kidneys with loss of corticomedullary differentiation. A renal biopsy is performed, and histopathological examination reveals glomerular sclerosis, tubular atrophy, interstitial fibrosis, and arteriolar hydradenosis. Which of the following pathological changes is most consistent with diagnosis of chronic renal failure in this patient? Segmental glomerular sclerosis and hyaline arteriolar sclerosis, focal segmental glomerular sclerosis and mesangial proliferation, diffuse mesangial matrix expansion and basement membrane thickening, crescent formation and fibrillary necrosis of glomerular capillaries, tubulointerstitial fibrosis and atrophic tubules. So the answer is tubular interstitial fibrosis and atrophic tubules. This was a case of chronic kidney disease, which is characterized by progressive and irreversible loss of kidney function over time. Histopathological changes include tubular interstitial fibrosis and atrophic tubules, which are indicative of chronic injury and scarring of the renal parenchyma. These changes result from the long-standing insult to the kidney, such as hypertension or diabetes mellitus or glomerulonephritis. These all lead to tubular injury, interstitial inflammation, and fibrosis. CKD will ultimately lead to interstitial renal disease and ultimately will lead to renal failure. So, which of the following is the most characteristic underlying cause of UTI in this patient? Most uh, uh, likely pathological changes. 40-year-old woman presents to a primary care physician with complaints of dysuria, urinary frequency, and suprapubic discomfort. She reports a history of recurrent UTIs over the past year. Physical examination is unremarkable, and urine analysis shows pyuria and bacteria. The urine culture is obtained, which grows Escherichia coli. So, which of the following pathological changes most characteristic? Squamous metaplasia of the urothelium, leukoplakia and dysplasia of the bladder mucosa, chronic inflammation and lymphocytic infiltration, papillary urothelial carcinoma with invasion, bacterial colonization and mucosal adherence. So the correct answer is bacterial colonization and mucosal adherence. UTI are commonly caused by bacterial pathogens, and most frequently it is due to E. coli. Now, these E. coli will colonize and adhere to the urothelial lining of the urinary tract. And the initial step in the pathogenesis involves bacterial colonization of the periurethral area, followed by ascension into the bladder and subsequent adherence to the urothelial mucosa. Thank you for watching. Keep studying.